So I'm Rachael Laing. I'm here to do the head to toe assessment. I've made sure the room is private. I have raised the bed to working height, and I have over here on my workstation my stethoscope that's been cleaned. I have a dirty area here and a clean area here for what I'll be using this assessment. My pen light's in my pocket, and I'm going to sanitize my hands as I introduce myself to my patient, Miss Teddy. Hello, Miss Teddy. I'm Nurse Rachael. I'm here today to give you a head-to-toe assessment, which will take about 20 minutes, where I ask you a number of questions. I do some palpating and listening to heart sounds and lung sounds, okay? So first, can you please tell me your full name and date of birth? Miss Teddy Laing, date of birth 3/23/2000, and that matches your hospital tag. Excellent. Tell me if you have on a scale of 1 to 10 what your pain is like right now. It's like a 3. Okay, good. So you're not in too much pain. That's excellent. And we're just going to take an overall look at you. And I can see that it looks like you're breathing normally. There's no wheezing. You're not efforting to breathe. The chest is rising and falling normally. You seem conscious, alert, A+O alert, and I'm drawing a blank, ×4. Your ABCs, airways, breathing, circulation look great, and no apparent distress, NAD. Alert and oriented ×4. That's coming back to me right now. Excellent. I'm looking at your color. There's no pallor, no cyanosis, no diaphoresis. Your skin looks dry. The color of your skin looks appropriate for your animal breed. You look healthy, okay? Good hygiene. I'm not seeing, you look like your muscles are even. You're symmetrical. You look a good healthy weight. Your nutritional status is excellent. And I wanted to ask too if there's any cultural or spiritual beliefs that I need to know about as I'm doing this assessments. Okay, nothing? So you're good there too. Alrighty. So we're going to begin just by looking at the head. Do kind of a head, eyes, ears, nose brief examination. And I'm looking at your eyes. They're a beautiful black teddy bear eye color. You have nice eyelashes and eyebrows are present and healthy. Your eyes are symmetrical. I'm not seeing any swelling, edema, drainage, redness. They're in line with your face. All right, so the eyes at first appearance look really healthy. Looking at your nose, it's also very symmetrical. There's no redness, no edema, no swelling, no obvious masses. And again, the nose is symmetrical, very even with the face. Looking at your lips, they are healthy and full. There's no excessive dryness, no breakdown of the skin, no lesions, no obvious masses, no edema, no erythema. And the skin structure of the whole face looks good. The neck looks good. The trachea is even. Again, no swelling, no edema, no redness, that's erythema. Symmetry is very good. Ears are symmetrical with the outer canthus on either side. All right, if you tilt your chin forward, let's look at the back of your neck. My hands are clean, so I'm going to help you out here. There's no skin breakdown. The skin color looks healthy. It's a nice pink color. Again, no masses, no lesions, no skin breakdown, no redness, no erythema. That is erythema. I'm doubling up. So that's really all good stuff. Let's look behind your ears. Again, the skin is intact. It's a healthy color. There's no breakdown of the skin. There's no drainage. And the same thing on the other side. No masses either. No lesions, no masses. Looking at the scalp, I'm not seeing any infestations. Your fur, your hair is in really good shape. It looks even. It looks healthy. Not excessively oily. That's good head of hair. I'm going to take my hands and just feel your scalp. I'm not feeling any masses. That feels really good there too. Okay, I'm going to gently press on your sinuses, your maxillary and your frontal sinuses. Any pain? Any tenderness? No? Very good. Let's see how the nostrils. The nostrils are nice and patent. Very good. Can you please puff out your cheeks? Can you frown? Can you smile? Can you stick out your tongue? All right, so those are some cranial nerve tests, and you've passed those also with flying colors. I'm now going to take my pen light and we're going to look at your pupils. But before we begin, I can see again the eye color is a very nice color. Good black color. They look even. You're about a size 4 for pupils, which is healthy for a teddy bear. If I shine a light into your pupils, they constrict very nicely, and then they're constricting and they're dilating beautifully, which is very, very good. So again, there's no drainage, no excessive swelling, redness, edema looking in your eyes. If I look in your nose, the nostrils look healthy. There's, again, no swelling, no erythema, no drainage, no flaky skin. The color of the skin is good. And if you open up your mouth wide, I'm looking at the lips are intact. They're a nice, moist skin color. I'm looking at the mucosa in the mouth, looks healthy. The upper and lower palate looks healthy. The teeth are in good shape. The tongue is a nice pink color. It's not too coated. There doesn't seem to be any lesions, swelling, injury in the mouth, and the color looks good. So that's excellent. Can you open up your mouth and say ah, ah? So the uvula arises on phonation, which is great. So all of that very good. Let's now do a test for your cranial nerves with your eyes. So first you're just going to follow this pen light. The eyes move in as I move the pen towards you, and then the eyes move out. Excellent. And then follow the movement of the pen light here. Good work. So this is the 6 cardinal fields of vision, and you pass those beautifully. And when I look at the pupils, that is perla. So the pupils are equal, round, and responsive to light. Very good. I'm going to look inside your ears. No drainage, no erythema, no edema, no masses, no swelling. Right. Does it hurt? How does it feel when I press on your ears? So look at the tragus and the auricles of the ears. Any pain or tenderness? Nope. What have you done your sinuses? Anywhere else around the head that might be painful? No. What about your lymph nodes? No pain? No tenderness? No. So the lymph nodes are easy to palpate. They're movable. That feels good. We're going to also feel the carotid artery. The rhythm is regular and +2. Rhythm is regular and +2. Let's listen to bruits with your carotid arteries. I'm using the bell of the stethoscope. Okay, and I'm not hearing any bruits. Very good. All right, so as far as your eyes, ears, nose, mouth goes, everything seems good right now. Let's now move to your upper extremities. So I'm going to roll up your sleeves. And looking at your arms, again, the skin of the arms is intact. It's a good, healthy color for your breed. I'm not seeing any obvious swelling, any deformities. Looking at the elbows, there's no breakdown of the skin on the elbows. I'm looking at your hands, your fingers. There's no clubbing in the nails, and the capillary refill is less than 2 seconds. The arm temperature is good. Any pain when I touch your arms? Nope. And the muscle bulk feels good. Let's test some strength in your arms. You're going to press your arms up into my hands, all right? And you're going to press them down, okay? Press on my hands. Excellent. Strength is +5. And now some range of movement, all right? So we're actually going to do range of movement in your neck and in your arms. So first, let's start with the neck. You're going to tilt your head to one side and lift it up. Tilt it to the other side, lift it up, lower your chin, and then just do some half circles. All right, so very good range of movement in your neck. With your arms, shrug your shoulders, lower them down, roll your shoulders, lift your arms up, lower them down, do some arm circles, hand circles. Squeeze my fingers as tight as you can. Okay, great. So strength is really good. Range of movement is excellent. So your arms, hands look good. The nails, again, look good. We looked at clubbing. We looked at capillary refill. So that's all good there. And then just a little skin turgor test. I'm just going to get a little pinch of your skin. And the skin goes back straight away, so you have very good skin turgor. You're well hydrated, and it looks like the skin is healthy. So now we're going to move to your upper, the chest area, your anterior thorax. So I'm pulling down your gown, okay? And first of all, I'm just going to palpate. Tell me if there's any pain or tenderness. Nope. All right, so that's good. And then we're going to feel, first, what I am looking at respiratory effort. Again, it seems even. I'm not feeling any lifts or heaves or PMI as I palpate. So we're going to start with, this is the aortic valve. I'm feeling there. No heaves or lifts. That's the pulmonic valve, moving down to Erb's point, mitral valve, and the tricuspid valve. And the rhythm, the heart feels good as I palpate those areas, right? There's no extreme respiratory effort that I can see. The breath so far seems normal, but we'll listen now, first of all, to the heartbeat, heart sounds, at least, using the stethoscope first to pick up the heartbeat. So same thing, aortic valve, pulmonic valve, Erb's point, mitral valve, and tricuspid valve. Now listening to murmurs with the bell, going back, tricuspid, mitral, Erb's point, pulmonic, and aortic. All right, so the rate and the rhythm feels normal. And now we're going to take your apical pulse for 1 minute. Excellent. Pulse is 73 and rhythm is regular. So very, very good with that. And then we're going to listen to your lung sounds. And there's 8 points here. So I'm moving quickly. I would tend to take much more time in a real assessment, and lung sounds are good. The skin of the chest, also the abdomen, looks intact. The color is congruent with the rest of the body. It looks dry. There's no excessive moisture. There doesn't seem to be any swelling, any edema, any redness, erythema. Okay, so let's cover you back up. We're now moving to your lower abdomen. Okay, so I'd like to lift up your gown to expose the lower belly. There you go. And I'm just going to first take a look at the lower belly. And what I see is, again, the skin looks healthy. There's no skin breakdown. The color is congruent with the sweet little teddy's being. I'm not seeing any bloating that looks excessive. No excessive movement with breathing. No skin breakdown, nothing intact, no lesions. Okay, so we're going to start by listening to your bowel sounds. And we start with the right lower quadrant using the stethoscope. So go right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I would listen for about a minute on each quadrant. For the sake of the video, I'm speeding things up. Bowel sounds seem normal. And then we do some palpation. Tell me if there's any pain as I start with the lower right quadrant, upper right quadrant, upper left, and lower left. You're good? Okay. So these are good. Then I would also palpate for scrotal or sacral pain, looking for any blanching, any erythema, any masses in those lower extremities, in the lower part of the abdomen. We need to listen to also the lung sounds on your back, okay? So, and I'm just going to assess for CVA. So let's roll you onto your side. And here we go. All right, so first of all, just tell me if there's any pain as I press on your back. Any pain or tenderness? No? Any pain? No? So there's no CVA. And then the lung sounds, all right? So once again, with the stethoscope, I'm listening at 8 places. The very upper part of the lung, and then mid-back, you're in between those shoulder blades, down the back a little bit, and then the distal areas of the lung, okay? And lung sounds again seem normal. Taking a look at the skin of the back, the spine is symmetrical, the scapula, there's good symmetry there. There's good symmetry with the bony prominences in the shoulders and in the pelvis. I'm not seeing any skin breakdown. The color of the skin, again, is in line with this beautiful being. There is no obvious masses nor lesions, and the skin looks dry. So the back looks healthy. Good stuff. Let's roll you back over. There you go. So now I'd like to look at your lower extremities. And so I'm going to move the sheet upwards and expose the legs. And just taking a look at the legs overall, They look symmetrical. There's no obvious deformities. The skin color is appropriate for the teddy bear. The muscle tone looks good. All right, so I'd like to feel the temperature of the legs, which is good. And then tell me if there's any pain or discomfort as I feel the muscles in your legs. No, and the muscle bulk feels appropriate for this teddy bear. Looking at the nails, the toenails look healthy. The capillary refill is less than 2 seconds, and there's no clubbing in those nails. Let's do a little test of the pedal pulse. Pulse is +2, and then the anterior tibialis pulse is +1. The rhythm is regular on both. I don't believe I did your brachial and radial pulses, so let's do that real quick too. All right, so the radial pulse, +2, rhythm is regular, and the brachial pulse, +2, rhythm is regular. Okay, so your pulses are good. So going back to the legs, right? So let's now do some range of motion in your legs. So I'd like you to lift one leg up, move it to the side, move it back, lower it down. And then do the same on the other side. Lift the leg up, move it to the side, move it back, and lower it down. And then if you would point your feet, flex your feet, and you can rotate the feet. Excellent. And then let's check on some strength here. So press your feet into my hands. Very good. Press your feet into my hands again, flexing. And now press down on my hands, and then press up on my hands. Okay, so you have very good strength in your legs. Strength would be +5. Range of motion is excellent. I'm going to cover you back up. So overall, Miss Teddy, you have done a great job today. I think you've passed with flying colors. So thank you.